The world is experiencing a mental health crisis. The church is not spared from these struggles. Therefore, it is crucial for the church to understand its role in addressing mental health. In this video, I will help us to better understand mental health, to know why the church should care about it, and to teach us how churches can respond. Mental health is more than just the absence of mental illness. It is influenced by a variety of factors: biological, psychological, social, and spiritual factors. It is important to differentiate between having a mental illness and having poor mental health. For example, even someone with a mental illness can still experience relative well-being if they receive loving support from the communities that surround them. Churches should care about mental health for 4 reasons. First, many people inside and outside the church struggle with mental health. Ignoring this reality makes the church irrelevant to the needs of its members and irrelevant to the world that Jesus calls us to reach out to. Second, mental illness often leads to social exclusion. Since the Bible commands us to care for those who are marginalized, we must care for those with mental health challenges. We must be missional towards them. Third, mental well-being and spiritual growth go hand in hand. Biblical virtues like joy, peace, and self-control are key elements of mental health. Therefore, churches must recognize that mental health care should be an essential part of their discipleship programs. And then fourth, church culture and practices can either promote or harm mental well-being. For instance, overworking church members can lead them to spiritual burnout. Churches must be aware of these risks and create environments that promote good mental health. So as you can see, churches must care about mental health. So what should we do? Here are 7 strategies that churches can apply. First of all, churches should know our role. Don't try to replace mental health professionals. Instead, complement them. As my friend, the theologian John Swinton observes, churches should focus on being a community of persistent, patient love, offering the kind of tender, loving support that mental health professionals cannot provide. Second, church leaders must take the initiative to grow in their own understanding of mental health issues. It is with sadness that I often hear church leaders describe our young people as a strawberry generation who are easily emotionally bruised. This stereotype ignores the profound social changes experienced by youth today that are a primary driver of poor mental health. So if church leaders want to help their young people, they themselves must have a better understanding of mental health. Third, churches can offer counseling services, either through trained individuals within the church or by creating referral networks to mental health professionals. Such services should also extend to pastors and church leaders who themselves are often under significant stress. Fourth, we must recognize that mental health involves more than just spiritual care. Physical health, social connections, lifestyle, they all play a big role. And so churches should encourage rest, exercise, and meaningful community involvement. Fifth, churches must avoid harmful interventions like mistaking mental illness for demonic possession. Proper safeguarding procedures are necessary in church to prevent abuse. 6. The whole church, not just the leadership, needs to grow in awareness and compassion. So preaching, teaching, and open discussions can help to reduce stigma towards those with mental health challenges. Lastly, churches should periodically evaluate their community's mental health and their own practices. This ensures that mental well-being is treated as an essential part of church life and ministry. My brothers and sisters in Christ, mental health is a pressing issue that the church must address with compassion and care. By understanding mental health, by recognizing its importance, and by implementing helpful strategies, our churches can become places of support and healing for those who are struggling. May the God of all peace be with you all.